explained the determinant of hypertension, types of hypertensions, and the likes. I'm still Dr. Abdulaziz Kolawole, the CEO, Leading Care Integrative Medicine. In this video, I'll be explaining the ABO blood groups and hypertension risks, importance of lifestyle medicines, and modes of treatment at our clinic. ABO blood groups and hypertension risk. We are talking about ABO blood groups. We are talking about the different blood groups that we have. We have blood group A, we have blood group B, we have blood group AB, and blood group O. Through our blood groups, we can know and determine everything that happens in our body or that is going on in our body. The blood group genes are located on chromosome number 9, band Q34. And in our body, we have a lot of genes. And it is only genetic medicine. We need genetic medicine because there is no biochemical function going on in the body that is not being controlled by a particular gene. There's nothing in our body that is not being controlled by a particular gene. So that is why we have to promote and subscribe genetic medicine and nutrigenomics, which I will explain in few minutes now. So we cannot leave gene out of our medicines and out of our nutrition. We need to know. So the reason we need to know the ABO blood groups and hypertension risk, as I said earlier in our previous videos, that each of the blood groups has a way that they influence our body to create a particular ailment. Now, let's move on. Blood group O. Because of our time, I don't want the video to be longer. Blood group O risk factors. They have a number of risk factors. But because of our time, I just mentioned maybe one or two. Carbohydrates. Blood group O's generally either positive or negative. Their problem that they have most that leads to their hypertension is not coming from fats. And in fact, the standard dietary plan for hypertensive patients is to avoid fatty foods. They tell them to eat more vegetables. This does not go with blood group O. Does not go with blood group O, because accumulation of fat is the cause of BP, blood pressure, but the source of the accumulation is different from one blood group to another. It is true that it is accumulation of fat that leads to BP, yes, but the source of that fat the sources are different. They are different. So when you are talking about blood group O, their source of fat accumulation is not from fat foods or fatty foods. So it's from they have problem with carbohydrates. So that is number one. They also have problem with hypothyroidism. they have problem with their thyroid glands. So the risk factor that blood group O asks that leads to their own BP, number one on the list is carbohydrates. Carbohydrate is their risk factor, and the most leading factor, either blood group O positive or blood group what is it called, O negative. Now, because of our time, I don't want the video to be lengthier. We have blood group B. Blood group B also has their own risk factors. Most of their risk factors are from grains, whole grains. Most of the blood group B risk factors, they have problem with food, especially grains. We are talking about corn, wheat, rice, sorghum. All products that contains any of this, any blood group B should avoid it. If you have not been diagnosed to have BP and you are taking this, watch out very soon if care is not taken, plus or minus some other factors, you might be diagnosed. And if you've been diagnosed already, stay away totally. All products that contain or that are made from these, from corn, wheat, rice, such as bread, biscuit, cakes, pastas, spaghetti, macaroni, name them. You just have to move away from them. So, but there are some other grains too that are good for blood group B, especially oats, anything oats. Now, among the factors or the risk factors that leads to blood group B hypertension is stress also. So stress is one of the factors that leads to their hypertension also. So, and let's move on. They have them a lot. Blood group A. Blood group A have many risk factors, but among them we have low IAP, intestinal alkaline phosphatase. They have problem with these enzymes in their intestine. That is why they say one man's meat is another man's poison. They have problem with meat. So among their risk factors, that is one. So most of the problems of BP for blood group A's lies with in fact, most of the problems most blood groups have, you find it in blood group A. So if you want to advise blood group A, you advise them to do more on carbohydrates, vegetables, and fish, as you can see now. So, and among the risk factors also, they have high level of factor 8. Now, I said it earlier in our previous videos. They have high levels of factor 8, which help the blood to clot. They have problem with blood clotting, leading to blood viscosity. So, also they have high level of cortisol, that is stress hormone. So it's also part of their risk factors also. But also they have some foods that even not only them, all the blood groups have prescribed food for them to eat to prevent, cure, and get rid of their hypertension, taking care of their blood vessels. and they have foods that they must avoid, that will lead them, if they don't avoid it, will lead them to have and getting high blood pressure. So blood group O should live on what? On vegetables, fish, as I said earlier. So we have blood group AB. Blood group AB risk factors. In fact, they have many. They have the highest risk factors. Why? Because they have the attribute of blood group A and the attributes of blood group B. So all that goes with blood group A, all that is applicable to with blood group A, you also find it in blood group AB, because they have A already. All that you can find in blood group B, you get it in you also get it in blood group AB. So they are the most highest blood group that has the highest and largest risk factors of having BP. And not only BP, all ailments, including cancer, including diabetes. And fortunately for us, people with AB blood groups, they are not more as we see blood group O, blood group B. So among their risk factors, you have stress, you have grains, and the risk factors that are related to blood group B, food problems like grains, such as the blood group B also have. So the risk factors that they have in related to blood group A, that you can find in them also is low IAP, cholesterol related to high BP, and high level of factor 8, that is blood clotting and the likes. So just know your blood group and know all the risk factors and work by it to prevent your hypertension, and to treat your hypertension if you've been diagnosed to have one. Importance of lifestyle medicine. We need lifestyle medicine in everything. We need lifestyle medicine in everything. So in fact, lifestyle medicine is a medical approach that uses evidence-based behavioral interventions to prevent, treat, and manage chronic diseases. We need lifestyle medicine in everything, in treating everything and in preventing all ailments. So certain lifestyle or way of life can increase an individual's or group of people's or families' risk of high BP. So to have a fruitful result in any treatment, you must consider the lifestyles. So holistically, we look at 3 angles: biological, physical, psychological, and sociological. That is what is called the biopsychosocial aspect of health. We are not just going to you come into the clinic, we observe everything about you. We are not just going to give you drugs and go and do this and go. No, we want to know you. We want to know your lifestyle. You want to know what to do. You want to know your relation and thereabouts. So the pillars of lifestyle medicine are 6. We have nutrition. You want to know what you are eating, what you should not eat, what you should be eating, that will assist that supplement you want to give you, that will assist that herbs you want to prescribe for you. In fact, at times it might be only food that you are going to prescribe, nutrigenomics, that is going to work for you. You don't need any drugs, you don't need anything. So we want to know your activity, your daily activities, your physical activities. Are you having any? Or you are the type that is only in one place? You are having a sedentary life. You want to know your stress, your mental stress, your physical stress. How are you managing it? All these things contribute to one's hypertension. Substance abuse. Have you been exposed to toxins or exposed to alcohol, smokes, secondhand smokes even? Sleep. Are you skipping sleep? You don't have insomnia? Do you sleep regularly? When do you sleep? When do you normally sleep? And likes. Your relationship, are you happy at all, or are you sad? Are you what's going on in your social life? All these things contributes to one's uh, uh, health, especially when if you're having BP. So if you're having BP for a long time and you're using drugs, you take this, you've taken that, you've been treated by a professor from China, from India, from this, from that. You visited a lot of hospitals in Nigeria and abroad, and you're still having that thing. Take note of all these things. Look inward and check yourself. So exercise, for instance, less active people have 30 to 50% greater risk of hypertension. So, and we need these activities to empower our hearts to be healthier, because regular and physical activities make the heart stronger, and a strong heart pumps more blood with less effort. So I want to advise you to embrace nutrigenomics as a cure to hypertension. We are talking about nutrigenomics, that is, you are talking about how to eat according to your body making, according to your genetics. Eat according to your genetics. Don't eat the food that will not benefit you. Don't eat food that will damage your gene. Don't eat food that will cause you havoc. Eat food that will heal you. Let your food be your medicine, and your medicine be your food. Let your food be your medicine, and your medicine be your food. Embrace nutrigenomics. So, at our clinic, what we do, our protocol, hypertension treatment protocols, we prescribe we prescribe nutrigenomics. We plan your food, your meal, what you should take, what you should not take, based on your own blood group. You tell us your blood group together with some other things around you. So we give you nutrigenomics. When applicable, we prescribe supplement protocols also, and also we do cupping. As I've said earlier in our previous videos, you have issues. If you have issues with your blood vessels, the blood viscosity or the obstructions are there, so cupping therapy is good for that, to release and to clean the blood vessels. We use cupping therapy, and we use herbal precision prescription, because each blood group has some herbs that are good for them precisely. In fact, including condiments, spices. We prescribe herbs precisely according to your condition and your blood group. So if you've not experienced cupping before, this is cupping. This is the cup that is being used. Suctioning will be made on the skin, and the superficial incision will be made. Then the blood will come out. Then the cup can be placed anywhere. You can see the type of blood that is coming out. So you can imagine you can see how dark the blood is here now. So you can imagine what is going on. The peripheral resistances, the obstructions found in the blood vessels on this head, or in this head. So try cupping with us. One day, book your appointment, talk to us, subscribe our YouTube channel, call us on our phone, chat with us. Let us co-manage your hypertension. Let us treat you. Consult us on any of your health conditions, and we are good to go together. And we pray the Almighty be with us. Stay tuned and stay connected. I'm still Dr. Abdulaziz Kolawole.